Hey everyone, it's DrRic. Today's tutorial is on sprain strain. And I wanted to show you this thing. This is the TENS unit. Ooh, that is hot. The TENS unit it works to throw electricity very lightly into an area of muscle tissue. And right now I don't have a soreness, but if you can see, it's contracting on a burst basis. So it's bursting electricity from this little thing I'm wearing. And you can get these on the internet. You used to be able to get these prescribed by physical therapists, but I don't think it's affordable. And you can get them pretty decent on the internet. So I have to take it off because it's too distracting. So at this point, sprain versus strain. We have track season is starting, spring sports is starting. Everybody's kind of still tight from the winter, and I'm seeing that there's a lot of injuries that are occurring, especially with running season coming up. So Shamrock Shuffle is in about 3 weeks, which I hopefully will be participating in with my friend Ed. But people have to train. So the difference between a sprain strain and delayed onset muscle soreness or typical soreness after exercise is totally different. So I put together my own concoction of muscle fibers. The way the muscle works is it's two basic fibers. It's actin and a myosin, two fibers that are linked together by connection. So they contract or they expand depending on what you want them to do. Muscles have flexibility to a certain degree. They have a little bit of give. But if you stretch them or you force them to an exercise routine more than usual, or if they're injured and you push the envelope, what's going to happen is that instead of just getting the delayed onset muscle soreness, the typical soreness of working out, 24 to 72 hours later, you'll actually get to the point where the muscle stretches, it's trying to heal up, and then it pops. That's a muscle tear. So tears can be grade 1, grade 2, grade 3. Usually grade 1s are strains, strains where you have mild inflammation, maybe a microscopic tear. Grades 2 and 3 will be a little more severe, more discomfort, more disability, and sometimes complete rupture of the tendon, so it just comes off. And you can see that in a biceps tendon tear, you can see that in Achilles tendon tear. Not great, very painful. I had a couple guys with biceps tendon tears. The whole biceps just pulls down, and you see this little dinky bicep here because the two tendons up here, two tendons, will come off because of persistent soreness, a little bit too much exercise, not enough healing time, and then you do one lift and you hear pop. And that, in fact, that's what defines typical workout pain and strain. Strain specifically goes to muscle. Sprains go to ligaments. And in a nutshell, this is muscle, this is tendon, and this is bone. This is the insertion. That's exactly the way it works. So the bottom line with a muscle unit is that it goes from across a joint. It inserts into a bony prominence here. There's a ligament that connects to, or actually a tendon that connects to the bone. It connects via a broader base to a muscle. The muscle comes up here, connects to the tendon up here, and the tendon inserts over here. So you have this unit going across a joint. So when the muscle contracts, it moves the joint, whether it's this way or this way. In this case, you have two, but even with a finger, same thing. A muscle goes across the joint. So there's a tendon, muscle, tendon. And if I pull on the muscle, it goes like this. It's a little bit more complicated because the muscles in the hand are intrinsic and extrinsic, but that's the basic premise. Ligaments don't have any, like an ankle. Ligaments don't have any tendons attached to them. This is a ligament over here. So when you have somebody that pushes, like in Aikido or Jiu-Jitsu, you have somebody that pushes across the joint this way, it's not supposed to open up. So if you open it up too much, they're going to break the ligament. Eventually it'll tear. It'll force pain first, and then if you keep on going, you'll pop the ligament. That's a dislocation or a sprain, severe sprain. You can have an AC sprain up here if you take a shoulder block. Typical sprains are the ankle. Sometimes if a football lineman gets hit across the side of his leg, it's called, that's a MCL strain or sprain. So strains muscle, sprains ligament. In this case, we're going to talk about more of the muscle. So how do we first take care of strains and sprains? Well, first you have to do the typical first aid RICE, R-I-C-E. RICE stands for rest. I think it's relative rest. I think a lot of non-sports medicine docs would just say, get off of the joint, don't use it, put it in a sling, or get on crutches for 6 weeks. And I don't think that's doable. Well, I mean, that's the easy way out. But number one, if you're in the industry, yeah, 6 weeks off of work, that's a lot of money. And there's a lot of bills. If you're an athlete, that's in the average season in high school is 4 months. That's almost close to half of your season away. You're going to miss some important stuff. If you're a scholarship athlete, that's not doable. So you're owned by the school. So they want you to participate. So that's a little bit. So what we want to do is not force an athlete to go back in dangerously or force an employee to go back into his work dangerously. We want to compress the time frame of healing. So I say relative rest. That might mean getting on crutches for a short time until you see a doctor, physical therapist, chiropractor, or orthopedic surgeon. Or it could just mean don't lift anything at work, just be in a seated position. Or even if you can't do that, you just sweep. Nobody likes doing that. It's kind of demeaning. Just like being on the bench when you know your team is losing and you want to go and play, you're almost healed up, but you're still on the bench. You cannot leave the bench for fear that you'll re-injure your problem. So relative rest, that's the first part of the acronym. Second is ICE. Ice has to be used, I think, first. Everybody gets confused between ice and heat, what kind of modality you apply, because you can do that at home without even seeing a doctor, physical therapist, chiropractor, or orthopedic surgeon. But I think, without a doubt, icing is a little better. And here's the benefits. When you use heat, it gives you muscle soothing, so it's nice for the muscle. But if there's an immediate tear, you might actually, because there's heat, it attracts blood flow. It causes blood vessels to open. When blood vessels open to an area of a tear, it'll force more fluid in that area and you'll see more swelling. Same thing with an ankle ligament, an MCL strain or a sprain on the knee, dislocated shoulder. If you put heat on too fast, it's soothing, but it'll cause swelling. So I think ice is important. Now in Chinese medicine, I'm supposed to put ice on anything, but I think with Western-based medicine, I think it's important with regards to sports injuries. So how do we use ice? You have to do it cyclic. You have to cycle it on and off. So usually I'll say, this is the easiest way to remember, 15 minutes every hour. So top of the hour, 1 o'clock, 2 o'clock, 3 o'clock, 15 minutes, and then get the thing off. I see a lot of people leaving the school with ice bag wrapped up in saran wrap, and or wrap that the trainers have. I think that's okay, but typically what happens is when you put ice, this is a blood vessel, these two are blood vessels. You put ice on the skin on top of the blood vessel, it's very, very cold. In fact, you can get frostbite from it, so you have to be careful. But what you do is you cause a vasoconstriction. That's why when you put your hands in a freezer too long or hold on to something too cold, it turns white, especially if you have Raynaud's, or you get frostbite in the ears and nose. Well, anyway, you cause vasoconstriction and you close down the blood vessels, which is good. If you have a tear and you close down the blood vessels, you'll stop excessive blood flow. You're not going to stop everything. You stop excessive blood flow into the area, maybe decrease the swelling, in addition to what we're going to do later. But the problem is, after about 15 minutes, blood vessels usually accommodate and they open up. So after 15 minutes, it'll be useless. That's why you have to get it off. And the cool thing is, after 15 minutes, when you take the ice pack off, it kind of starts to open on its own, and it causes a push-pull, like a vacuum of fluid out of the area too, which is kind of cool. So you get the benefits of having a vasoconstriction initially, and then a little bit, I can't say a medium, but a nice gentle flow, increased flow of blood into the area and hopefully out of the area. So I think icing for the first 24 to 72 hours, very important. Sometimes you just do it until you see the physician, until you get your diagnosis. The only problem I said is if you're older and have thin skin, you can get frostbite. If you leave the ice pack on too long, you'll get blisters. That's the early stages of frost nip or frostbite, so watch the skin. You're supposed to put a piece of cloth there, but I've seen people put really thick towels on, and if you put too thick of a towel, you don't even feel the ice anymore. You'll lose the effect of temperature change. So that's icing. Next is C, compression. Compression is important because you can actually force fluid out of a joint just by wrapping the joint. The problem with wrapping a joint too tight is you also, if it's too tight, not only will you keep the fluid from entering the area that's injured, you might also choke off all the blood flow to the rest of the extremity. So you have to be careful you don't tie it too tight. So tie it too tight, you get numb and tingly, that's not good. Tying it too loose, you lose the compressive effect. So it just has to be enough. So I feel if you can get a finger breath in there by stretching it, that's good enough. So these you can find anywhere, ace wraps. Sometimes you'll have trainers actually wrap ankles up that have been recovering from a strain beforehand because it gives more strength, a little more proprioception. That's the other thing with regards to, as far as proprioception, when you have a wrap around you, you have a constant feeling you have a constant reminder that there's something around your leg because there's a compressive effect. Your pressure or organs in the skin will sense this pressure. So it's kind of like sitting up straight, telling your mom to always push you in the back to sit you up straight. Well, same thing with this. So I think the other benefit is that you will not use the extremity by mistake. Like some people forget they have an ankle sprain, so they get up real fast and they fall down. Or some people forget that they have a shoulder problem, they reach for something real fast and they continue tearing. Same thing with the bicep, you reach for something by mistake. So I think it's also a good idea not only to force fluid out of the area, also give you good feedback that this is an area of irritation. Then last is going to be elevation, RICE, R-I-C-E. Elevation is important because if I have an area of swelling to the distal extremity and I keep it lower than the drainage point, then it's going to be harder. I mean, you'll still get back, but it'll be harder, especially if there's inflammation, to get fluid back to the heart and you'll have a fat hand. Versus keeping it like this, it'll be easier by gravity to get the fluid out and back into the circulation. So when you're lying down, it's easy with a hand, but when you're lying down or when you have an ankle, you got to get the ankle up higher than the hip. So it's a little bit complicated if you have to work. At least don't let it dangle. So whatever you can do. And then comes the issue, should you be using crutches? Because most people will use crutches and they'll be standing like this and then dangling. You can't see my foot, but I'm just dangling the foot. I'm just hanging it up. Usually I put people in boots. That's just while they're ambulating to prevent any further damage, keep them from accidentally stepping on the injured foot. But again, it's usually going to be sit for most of the time and get the foot up at least parallel, maybe even higher than the hip, so it drains out. Same thing with the knee. So in the case where we have a calf strain, calf strains happen a lot. I'll hear a complete tear happen, usually on the tennis court for some reason. Most tennis players, especially beginning of the season, will be going back and forth laterally, so they'll be putting a lot of load. The gastrocnemius muscle is 2. That's calf muscle. You got 2 big heads. The medial head, the one towards the center of the body, is bigger. The lateral head is smaller, and sometimes usually you'll have a tear of the medial head. It could be because you're bounding, you're putting a lot of force on one leg and pushing off quickly to get to scramble to another hit. But that one push-off will cause the muscle, if it's sore or it's been trying to recover from the last couple weeks, force that muscle to tear completely, just like these things. It'll force it to tear completely, and then usually my tennis players say they felt like they were shot or somebody threw a rock at them, or they hear a pop, and usually at that point, you're screwed. In fact, one of the most notable sprains, that's a ligament tear, is the ACL. If you have the right hit to the right knee at the right time with enough force, usually it's a plant on AstroTurf, turn, pivot, and then catch and then get hit. You'll hear that ACL pop from the sidelines. And usually it'll be pretty decent pain, and that person won't be able to walk off, and they'll need the John Deere to carry them off the field, which you've had a couple times. But here's another thing with regards to icing. I told you about the Q or the 15-minute rule. These things are good. They're very, very cold, but they're flat, and it's hard to put this on a joint. So I actually like frozen peas, because the frozen pea, you can actually, a large bag of peas without the sauce. If you get sauce, it hardens up. Frozen peas or a Ziploc large bag full of ice cubes crushed up, will fit around the joint. Then you can wrap it up. This is, and those blue things that you get from the immediate care center. I used to work there. I have a couple here. That's just because we can't store ice. So it's just good for about 5 minutes. I see people about an hour later still trying to get cold out of it. It doesn't work that well. You're better off just getting a frozen pack of peas. It's cheaper. So that's what to use with ice. Those gel packs too, I don't think they work that great either. Those blue things that you can refreeze. I'd rather have just ice, plain old cold water or ice, or frozen peas or frozen vegetables. Another use for being vegetarian. So how to make a diagnosis. Once you've done the first aid, or the athletic trainer's done the first aid, how do you make a diagnosis? Well, there's a couple different ways. First, I'd say you have to see a sports medicine doctor. I would go to a sports medicine doctor because anybody can make a diagnosis just by the history or the mechanism of the injury. Doc, I was walking along, I stepped on a divot and my ankle rolled in. Okay. Doc, I was taken off from the blocks in my 100-yard sprint and I felt a pop coming off the acceleration phase. Okay, it's easy. You kind of, and I'm sure patients know that already. But, or attacking a hill if you're doing a marathon, or so the mechanism will give you the answer. You should, especially if we're trying to truncate the time frame of healing. The faster you come up with an exact diagnosis, the faster you can start therapy or get a replacement. So, how do we come up with a diagnosis? First, I think the easiest thing you can get is X-rays, just to make sure it didn't crack anything. And I had a guy come in. He came in. He said he fell down. He fell down on ice, caught his arm this way, caught his weight this way, and he said, I was able to move it after about 24 hours, and I think I'm fine. And of course, I got an X-ray. He broke his wrist. So a lot of people that tolerate pain, the subjective, you'll hear the mechanism. You can't always go by how bad is the pain. 2 out of 10? It's only a 2. I can still move it. It doesn't mean anything. I've seen people come in with completely broken bones still moving. I actually saw a mixed martial arts competition. A guy got into an arm bar and popped the arm, and the guy said, I'm fine. And he didn't even flinch. But I mean, you could see it in slow motion. The guy was getting him into the arm bar, and you saw him go like this, and you can see everybody go, oh! So don't always go by pain level or pain intensity. The mechanism is important, and then the diagnosis will help. So X-rays are a first start. You can at least rule out that there's no bone involved. If there's no bone involved, great, you just have a muscle tear. Sometimes you can go for an MRI. X-rays are about $200, depending on the body part. MRI is about $3,000 to $5,000. And one of the benefits I have is I go to a hospital and I know the MRI person. But I mean, I do this legitimately. I have an HMO. I get my orders taken care of, my referral approved, and here is an MRI. So this is an MRI side view of a leg. This is the calf muscle, this is the kneecap, this is the end of the femur where the knee is, and this is the beginning of the shin bone. This is the shin bone. This person obviously has growth plates, so he's growing. Here's a little bit of the ACL. You can't really see it in this plane. There's a bunch of fat with a patellar tendon. This is the calf muscle. So if there was a tear, you'd actually see that the calf muscle is all one color. It's all gray because a muscle has a distinct signal when you go into a magnetic resonance imaging machine, a magnet. If there is a tear here, you'll see a lot of fluid. Fluid will be looked at or appear as white, like this white. This is bone that has its own reason for being white, but you'd see a bunch of white going across here, and you might see tendons and muscle coming apart and then just black. You shouldn't have that, obviously. So that would be a complete tear. In this case, there's no tear. It's just a muscle strain, probably grade 1, which is really good. That means the runner will probably be able to get back very quickly. And that brings me to my next thing. How do we make a runner come back quickly? Well, there's a couple different things. And then there's also this ultrasound trick we used to do, because sometimes athletic trainers in training rooms, they only have electricity, like the electric stim box, or they have ultrasound. You can actually put ultrasound on an extremity, because this modality, it's not invasive, but it'll soothe by heat and using ultrasonic waves to stimulate the muscle later on in the injury. By heat, it'll help flow blood into the inflamed area. But if there's a fracture to the humeral bone, say if I'm over here, and you put ultrasound on top, usually the bone that's broken doesn't like that ultrasound, so it'll start to become painful, versus a muscle a tear, or grade 1, grade 2, or grade 3, which after the proper amount of healing, when you apply ultrasound, it actually feels very soothing. So that's why I put there. How do we take care of this? I would always get into physical therapy, athletic training, chiropractor, or massage ASAP. If you're an HMO, you got to get a referral to get to physical therapy, and you got to get an appointment with the physical therapist to get in. And a lot of physical therapists are busy. The ones that I use at Advocate, I think are great. Lori over at Streamwood Park District is awesome. She's been there for a long time. She knows her injuries. She knows how to take care of my patients, and so do all the other physical therapists. So the physical therapy, massage therapy. Sometimes, even if a massage therapist isn't going to do modalities like ultrasound, electrostimulation, steroids through the skin, massage therapists can help soothe the muscle. Because what happens when you tear a muscle, say I completely tore this, or that calf was completely torn. What's going to happen is that when you have a tear, the muscle is going to shrink up. It's going to try to protect itself and heal up by doing no further harm. It's kind of like its own body cast. So what happens with that is that you have the joint becomes contracted both above and below the point of injury. So a massage therapist can ease that up, especially if you tear trapezius muscle. That's such a broad muscle, or a lat, or a pec. That's such a broad muscle that you have to kind of relax all the other muscles, or else you're not going to be able to breathe, or lift your arms up, or wipe your butt. So massage therapist is awesome. Chiropractors, I think I see some chiropractors that do great work, and they have modalities, and usually get in real quick. I think chiropractors have the same limitations as physicians, and you're limited to a 15-minute visit. So they can get in, they can do a couple of different things as far as manipulation. If they're old school, they can manipulate the back to take care of the extremity, which is really cool. Those are mixtures and straights. I'm not going to get into that right now, old-fashioned versus new school. But physical therapy, I think, is usually going to be the guy, the gal that gets you back into your sport, gets you back into work. I think these guys, these are doctors. Physical therapists nowadays have to have a doctorate, which is a lot of studying. So I think that when you have more, the higher you go with your studies, your diplomas, the more problem-solving skills I think you have. Like me, I didn't stop at family practice. I also went on to acupuncture, also went on to sports medicine, also went on to integrative medicine as a fellowship. And I'm going further because I think it's important to have the biggest tool bag for figuring out the problem fastest. So get into massage therapy first. Next would be, I think, acupuncture. I think acupuncture is great. This is a typical needle for acupuncture. Yeah, I just do this anyway. So some of you might say, oh, I'm afraid of needles. Acupuncture really, it's not the same thing as a hypodermic needle when you get blood drawn. Acupuncture is a very fine needle. They range in size. So this is my container. This is a needle. This is my skin. I'm going to just put this into my relaxation point, and there it is. So usually with acupuncture, it works differently than massage therapy, physical therapy. They use meridians in Chinese medicine, and this happens to be one of the meridians that relaxes. So hopefully I can start slowing down on my conversation and relax. I kind of feel that already. That's funny. It might be a built-in mechanism or placebo response. Doesn't matter. So, but you have to be going to a certified acupuncturist in the state of Illinois. A lot of chiropractors do it in their office. A true acupuncturist, Beijing or Chinese trained, I think is the best. I'm good with acupuncture. The chiropractors are good with acupuncture, some of them. A Chinese trained, that doesn't have to be, but I think the ones I see trained in China they can run circles around me. So I like Dr. Yu Zhu over in Arlington Heights. There's a Dr. Peterson in Geneva, and then Janine over in Crystal Lake. All excellent with what they do. Dr. Peterson and Janine have their own places. Obviously they're not trained in China, but they're very good with what they do. So acupuncture, I think, is a nice way to also get the inflammation down, compress the time frame of healing. So the only problem is that you won't get it paid for by insurance. So I just took the needle out. So that's the needle. It's very tiny. You can hardly feel it. It's not paid for by insurance. I think it's like $100 to $75 for the first visit, and maybe less after that. But they can help. So if you want to compress the time frame of healing, you can use Western medicine and Chinese medicine together. So big gun versus pop guns. So big guns usually mean prescription medicines. That's where I can compress the time frame of healing very fast. Prescription medicines have very big side effects too. So I just gave my friend Monica steroids, and unfortunately one of the biggest problems with steroids, well, there's a couple. Number one, insomnia. Number two, anxiety. Number three, weight gain. Usually doesn't happen in a 7-day burst. I like to call it a steroid burst, but I think that's the fastest way to get rid of inflammation quickly while we're waiting for the usual things to take advantage of as far as insurance is concerned. So for what it's worth, if there is too much weight, then we just cut the steroid off. I mean, you can just stop it cold turkey. And I don't think you have to taper. I don't like the Medrol dose packs. Even with a child or a young person, adolescent, I don't think you have to taper if you're going within 5 days. 7 days at the most, but 5 days, the adrenal cortex doesn't get used to the steroids, so you won't have this crash of no energy afterward. But if you're very, very sensitive and you don't know what to do with pills, I guess the Medrol dose pack comes in a little packet. You just pop them all out. Easy to understand. I just don't think it's effective towards the 4th, 5th, and 6th days. So those are the big guns. Anti-inflammatories too. Steroids are the biggest anti-inflammatory, but there are prescription anti-inflammatories, and I have a tutorial from before on NSAIDs. Then muscle relaxants. Muscle relaxants are great because they help soothe, but the problem with soothing muscle, just like me hitting my meridian point, the problem with soothing muscle is that the brain is also soothed, and you get sleepy all day. I think I had a nurse in Central DuPage Hospital. I gave her a muscle relaxer. When she was leaving, she backed up, and hit a pole in the parking lot. So, not good. But those are the side effects, so you have to watch it. If you're just going to use it at night, though, I think it's reasonable, because hopefully if you take it early on, like dinner time, it's out of your system by 6 or 7 a.m. Everybody's a little different. That's why you have to test your doses out. So those are there's also other topicals that compounding pharmacists can put together. Matt over at Wholesome Health Pharmacy in Hoffman Estates, great. He can put in essential oil, he can put in anti-inflammatory, he can put in a muscle relaxer. If you're super sensitive and you don't want to take anything orally, or you have IBS or GERD or super sensitive with your gut, you can actually get it in topical form and have it just soak through the skin if it's blended by a compounding pharmacist properly. But the problem is I don't know the price. Matt's pretty good with his prices compared to others, but give him a call and then he can always let me know. So those are the biggies, but then there's also Popguns. I think enough Popguns will still be an effective job. So skullcap is a great way to calm down. This is skullcap. It's an extract by Herb Farm. It's called a nervine, a neurotonic, and no side effects to this. But the Scutellaria, the plant it comes from, has this way of relaxing. Used to use this for seizures a long, long time ago, probably at higher than normal doses. But I think this won't hurt even kids or adolescents. I probably wouldn't. I have to be careful with the adolescents, but every hour if you had to, as far as an extract. There's also valerian root. I didn't have any today. Valerian root, usually use it at night to relax. It also calms down too. Essential oils like lavender help to calm down. For me, sandalwood helps to calm down. And that's where you can also ask a massage therapist to do that too. Or if you go to a physical therapist that doesn't mind, she can put on, or he or she can put on the essential oil and then force it in with phonophoresis, ultrasounding. This is my favorite Panaway. I've tried doTERRA's blue something. I didn't feel it was as good as this. This has got me through 2 marathons. And I told the story before. You can't carry a bottle when you're running, supposedly. So I had to put in a Ziploc bag and stick it in my shorts. But by the 13th mile, I was empty, and I was trying to get my hot spots. And I was looking in the bag, because essential oil is actually pharmaceutical grade. It can be eaten if it's a good quality. So I love this stuff. And you can't overdose on topical, just like Matt's stuff. Well, Matt's stuff, because it has medicines in it, it can give you a problem if you're super sensitive. There is one topical that is really hard to get approved. It's called Pensed. It's Voltaren solution in drops. The Voltaren gel that insurance usually pays for, I don't think works that great. The vehicle that you put it on, the gel just doesn't penetrate it through. I did use the solution. It's like 20 drops, and I put it on my knee. It helped great when I was powerlifting and I had knee pain. But I'm super sensitive to medicines. I don't like taking medicines nowadays. But it gave me an upset stomach. The anti-inflammatory actually got through my skin, went into my bloodstream, hit my stomach, and caused irritation to the stomach, unless that was placebo or nocebo. Who knows? But that's an option too if your insurance is good. So the other thing is really important. I would avoid certain foods. So even if you don't have any problem with dairy, I don't like dairy. I have a lactose intolerance, but I think there's so much stuff in dairy, especially if you get it standardized dairy or conventional dairy, that you're asking for the antibiotics the cow had on the farm or the CAFO. You're asking for the steroids that were used to make the cow make milk all year long. I don't think I would do that. So there's all these substitutes now: flax oil, flax milk, coconut milk, hemp if you can find it, almond milk, cashew milk, soy milk. All of them are pretty good. If you're going to do the soy, try to go organic, but the rest of them are just as good if you want that for your breakfast. But also for breakfast, I would stay away from high carbohydrate hits, because when you have a lot of carbohydrates, especially if they're what's called glycemic index high, they are processed excessively, they're going to cause an insulin spike. And when you have an insulin spike, it causes more inflammation. We don't want, in fact, with muscle, insulin is catabolic, it's not anabolic. So glucagon is anabolic, but I don't want to talk about it right now. I'll probably do a keto talk soon. But we want to stay away from crappy food. You want to use the proteins. You got to get some proteins in, especially if you're trying to heal up. So typically, McMaster University in Canada came out with a study showing an athlete, a powerlifter, can go up to 2.4 grams per kilo, which is a huge amount of protein. I don't know how you're going to fit that much in. Since the gut can only handle about 20 to 30 grams of protein at a time, and we all eat about 2 to 3 meals a day, I can at least go 30, 30, and 30. That's 90 grams of protein. For a little kid or a developing adolescent, I try to do a dominant amount of protein. I do plant-based protein, but you can choose your own protein. And doing protein and trying to get it in all the foods, I think, is valid. It's cheaper, but if you want to be exact, I do the powder. So if you're not a vegetarian or vegan, go with whey. It's cheaper. If you are vegan, go with plant-based proteins. Just a little more expensive, and it's harder to get that many grams out. But just for the short time of a window of 4 weeks, I think it's worth it. 3 times a day, 20 grams at a time. And then keep your diet very, very healthy. Fluid, you got to push fluid. A lot of us are already dehydrated. When you're dehydrated, the blood vessels collapse, and there's not that much blood flow to the inflamed area. You want the blood flow to be perfect so it can whisk out all those byproducts of inflammation. So keep on tanking during the day. You should be peeing every 2 hours. Should be semi-clear for the first couple days of the week of your injury, please. But not caffeine. I don't think you should be doing caffeine, alcohol, coffee. Keep it to a limit. So it's also important to get sleep, because sleep is when we repair the brain. It's also when we repair muscle. So if you can't sleep, then we use the muscle relaxants. I don't like sleeping pills. Ambien is probably okay. Xanax, forget it. I think that just screws up your sleep or your REM. You'll get to sleep, especially if you're anxious, but it just doesn't give you enough downtime. You want to be out and not move as much. Tossing and turning all night, waking up every couple hours to pee because you have too much coffee or alcohol, it's going to screw up, and then this muscle won't actually be able to heal. You're supposed to be in a semi-paralysis mode, and that's when the muscle can rebuild itself overnight. And that's also when the gut sends out its anti-inflammatory little probiotics to start rebuilding everything that was broken down from the night before. And again, skullcap helps with relaxation, in addition to valerian, 5-HTP, melatonin, all really good. You also have to watch out for collateral damage, because if you already had a knee problem or a back problem and you now have an ankle problem, you're going to be walking weird, especially with these crutches. Or if you just use one crutch, you'll be walking weird, and that's going to set you up for irritating the other old problem again. If you had a trigger point from before and you put this into a sling, or trigger point over here, and this is slung, and you're going to do a lot of work with this side, you're going to flare that trigger point up, so you have to be careful. That's why we want to compress the time from all this healing. So whatever you did to cool down that other hot spot before, pull that into play too. So obviously your schedule for the day is going to be mostly rehab, but you want to get over this thing. I think you also need a coach as you start to accelerate, because usually the average strain, depending on the severity, 1, 2, or 3, 6 to 8 weeks, depending on your age too, and your fitness level. Sprain, if it's a ligament, can be a little longer. Ankles are tough, especially if you have to get back into bounding or jumping or landing again. MCLs, if you put a brace on, there used to be a protector, MCL protector. Stone Cold Steve Austin from the old World Wrestling Federation, or WWE, whatever it was called, used to wear this ACL derotation brace whenever he went into the ring. Kind of cool, but those things are so old school. I think they're just for show. But sometimes using the braces and or a wrap even past the point might be good for you, because it will help. Again, that's what kinetic taping is supposed to do. Taping is supposed to give you gentle feedback by putting tension. If you go in the wrong direction, that your skin starts to tell you, hey, go straight, instead of torque too much. So it's always just feedback while you're getting back into the hang of things, and you can go straight on or do lateral cuts. Transitioning back into the sport, once a coach or trainer or physical therapist or doctor sees that you're starting to evolve, get back in the swing of things, be pain-free, then we'll start to test you with more and more of the activities to make sure you're healed up 100%. So in the case of a calf, we start to do calf raises, one-legged stances, jumping with both legs, jumping with one leg. An ACL repair was usually one of the criteria for getting them back into basketball is how far can you do a one-legged hop. Has to be about 80% of what the other good leg can do. I think one of the guys I trained with at DePaul, the fastest he ever got an ACL repair patient back into playing was like 4 months, which was painful. I mean, he did fine, but to see a guy slam dunk from the foul line at 4 months coming back from an ACL injury and repair, it was kind of spooky, but he did okay. So that also says a lot to do with the preemptive strike. If you have an injury from before, you want to be training with the right physical therapists, athletic trainers, and coaches so that you don't get into this mess beforehand. And I really think stretching is very crucial. And I know there's some coaches that don't like stretching. I think it burdens up the time that they have to coach. But at least, there's studies that say that stretching is, I think, with some distance runners that were tested, actually, a lot of the studies didn't really say whether your runners were distance or runners were sprinters or just throwers. But the small subsets of studies that I read, the majority of them were underpowered. Majority said, with the smaller studies, that stretching maybe hampered the performance time, and it didn't really help with injury prevention. But you got to get these studies out like 3-5 years to see if it actually helps, because the habit is important. Pre-conditioning before season starts up, before the heavy hits occur, before the sprint from the blocks take off is really important. So I think stretching is very important. I would always do pre-workout stretching, pre-season stretching. I'm a yoga practitioner though, so I see the value in it. But maybe if we start to have more randomized controlled trials to prove or disprove that it hurts and doesn't help, then I buy into it. But nobody's going to put $1 million into a study like that. So I just say, if your coach doesn't help you with stretching, do it on your own at home and get your physical therapist or your coach to teach you what to do. So finally, I just talked about this already, but the new activities you're going to learn from this point on for the next season are very important to incorporate, even if it's just a work injury. If you didn't have an exercise routine before, or you had like a 1 hour workout routine in the gym, what you really should do because of your injury, because that will always be a sore spot in the near future, is to incorporate a cheap 5 to 10 minute routine that the physical therapist showed you and dump it into your usual routine. Try to make it a habit, because once you're injured, I believe that part is susceptible to another injury down the line. It could be 10 years. I have a hamstring tear from high school. I was a third leg of a 100 medley. That's a 400-meter run where 4 people do 100 meters each. I was the third leg, and as I was coming around the turn, I could feel a pop of my hamstring. But I was able to hand off with a baton, but from that point on, I didn't know about rehab, at least the rehab in the 80s was terrible. But I only, in the last 7 years, was able to get this hamstring back to where it's flexible just like the other side. Because whenever I would get into a certain pose, I would feel that the hamstring, just like high school, is about to pop again. So maybe it was my mind, but I really think it was still tight from high school, because I never got rehab for it. So I think you should always add back to future to prevent anything from happening again. So hopefully, thank you for watching up until this point, but hopefully this gives you a little bit of an idea about how to take care of a sprain or strain. And I know I just talked about strains, but sprains are essentially the same. Sometimes sprains, because they involve joints, can be complicated because after you completely tear a ligament, you might start tearing things on the inside. Like in the case of a knee, if you have an MCL tear, you might have an ACL tear as well. So you have to be careful with those things, but still, it's the same concept of what we do with first aid, diagnosis, and rehab. So, and then post-season conditioning and preseason conditioning for the next year. So if you have any questions that you have, put them on the comments section down below. Otherwise, please give it a thumbs up and share this for anybody else or any other families that are going through. There are a lot of inner city schools that don't have trainers, believe it or not, or some people they have a high deductible, so they can't afford going to physical therapists. So they're just, you might be able to share this with them. If you subscribe to me, I will have other tutorials coming up, or minute clinics, or unboxings. So thanks, and I'll see you in the next one.